Ever thought about how people manage like the basic stuff in their day? You know, like taking their meds when they're also doing something as big as fasting? It's kind of wild, right? Like where the everyday meets something so deeply meaningful.
Yeah, yeah, it really is.
Huh.
Especially when you think about practices that involve going without food or drink for long stretches.
Right. Exactly. And so that leads us to our deep dive today. We're going deep into Ramadan fasting and how Muslims who are managing chronic health conditions handle their medication use.
We've got a whole bunch of research here exploring what it's really like for them, how they understand it personally, and the real challenges they face.
So for you listening in, we're aiming to really unpack all of this, to pull out the key insights from what these studies tell us. We want to understand how this community balances their deep faith with the practical side of staying healthy.
And it's such an important thing to look into when you consider how many people we're talking about. A huge global Muslim population, and a significant number of those folks are living with chronic conditions but still choose to fast.
So getting this isn't just about knowing some cultural practice. It's really vital for making sure they're well and for figuring out how healthcare can better serve this whole community.
For sure. Okay, so let's begin by looking at this whole thing about when people feel they're actually exempt from fasting.
What's interesting here is this really subtle understanding of when Islam allows those exemptions. The Quran itself in Surah al-Baqarah states clearly that people who are sick or facing hardship don't have to fast.
Exactly. And the research really shows the different ways people interpret and apply this guidance in their own lives. For some, it's pretty straightforward. If their medical condition isn't well controlled, like if someone has unstable diabetes or a woman is pregnant, they often see themselves as automatically exempt, especially if they need meds during the day.
Yeah, that makes total sense. The main idea is to avoid causing unnecessary harm, and needing to take medication regularly during the fasting hours would definitely fall under that.
Absolutely. And something else we see is the big role that trusted figures play in people's
Oh,
decisions.
yeah, for sure.
People often rely on what their doctors say, which makes sense from a health standpoint. But what's equally important for many is the guidance they get from their religious leaders, the imams. It's like they're looking for a double confirmation, medical approval and spiritual permission. So for you listening, it shows how navigating health during Ramadan isn't just a medical choice. It's really tied up with faith, and often means seeking guidance from several trusted sources.
It really shows how many approach their faith and their health, they see them as connected parts of their lives. And it's interesting how individuals might, in some cases, prioritize one of these forms of guidance over the other, but then you also have the self-assessment thing that comes in.
Yeah, and this is where it gets really interesting for you. Some people use their own judgment, maybe based on their past experiences trying to fast while managing their condition, to decide if they can actually do it in a given year. We heard about one person with diabetes who had tried to fast for years, but just couldn't keep their blood sugar stable and still focus on their prayers until they started using an insulin pump. Even after that, they kept trying to fast each year. That really shows a strong personal commitment.
It really does highlight that strong personal desire to fulfill this religious obligation. Our sources also mention that things like the weather can play a role in these decisions too. Bad weather, especially extreme heat, can really influence the decision, particularly for those with conditions like high blood pressure where getting dehydrated could be risky.
Yeah, that's a very practical thing to think about, of course.
Hmm.
But what's really fascinating is when we look at why some people choose to fast, even though they might qualify for an exemption. What did our sources say about those reasons?
Well, this is where it gets really interesting. It seems like several things are at play. One is their ability to manage their condition well, maybe by adjusting their medication schedules carefully or by monitoring things really closely. If their doctors or their religious leaders give them the okay, that seems to give them a good amount of reassurance and encouragement.
Right, that external validation from those they trust seems to be key. But there's also a really powerful element of internal and external satisfaction, that deep feeling of being a good Muslim, of fully participating in Ramadan alongside their community that carries so much weight and motivates them.
That's it. One person even said that by fasting, they felt like they were showing other Muslims just how strong their belief was. It says so much about the social and community aspects of Ramadan. It's obviously not just a personal thing.
Not at all.
So for you listening, it's clear that the decision of whether to fast is complicated. It involves personal health, religious guidance, and social factors.
Yeah, it paints a really vivid picture of all the different internal and external pressures and motivations that are at work.
Yeah.
Okay, so we've seen that people have all these different ideas about who is exempt from fasting? Now, what happens when it comes to actually taking medication during Ramadan?
Well, the general consensus is pretty clear when it comes to pills and stuff. They're usually avoided during the fasting hours. That's like a fundamental part of the fast itself, right?
Yeah.
Abstaining from putting anything in your mouth. But when you start looking at medications that aren't taken by mouth, that's when things get more varied and nuanced.
Yeah, that's right. There seems to be a general acceptance for things like inhaled medications, like inhalers for asthma, as well as intramuscular and subcutaneous injections.
So those that go directly into the muscle or under the skin, like insulin,
Right. Those are generally seen as not breaking the fast.
that seems to be the common understanding. But, our research actually shows some uncertainty around other types of non-oral medications, specifically eye drops and nasal sprays.
Interesting.
Some folks choose to avoid them entirely during fasting hours just to be on the safe side, while others believe they don't actually break the fast.
It's fascinating how these personal choices and levels of strictness come into play. And it's not always just based on what individuals believe, right? There's also the different religious opinions that can affect how people use their meds.
Exactly. Our sources point out that religious leaders might have different views on this. Some might say certain medications are haram, meaning forbidden. Others might call them makruh, meaning disliked or offensive. And still others might consider them halal, meaning permissible.
Right.
This lack of a totally unified religious stance can be confusing for people and definitely influences their choices. So what this really shows is that there isn't one single religious ruling, which means people often have to figure out how to balance their understanding of their faith with their practical health needs. This also suggests that maybe clearer, more unified guidance could be helpful.
It's like trying to navigate a maze of personal beliefs, practical health stuff, and differing religious guidance. One of the things that stood out in the research was this person whose wife actually stops using her eye drops and nasal drops during Ramadan, even though she personally thinks they're okay to use. It really emphasizes the power of individual interpretation and maybe a desire to be extra cautious and devout during this holy month.
It really does. It shows that even when someone doesn't personally believe there's a strict religious rule against something, the desire to fully observe the fast can lead to these kinds of self-imposed restrictions.
Yeah.
So with all these different ideas about who's exempt and how meds should be used, how do people actually interact with their healthcare providers during Ramadan?
This seems to be a really critical area, and our sources show a few distinct approaches. Some people rely heavily on their healthcare providers, their doctors and pharmacists, while others might depend more on people within their community who aren't healthcare professionals or even manage things more on their own.
What's interesting is that even among those who do talk to their doctors, there are different levels of engagement. Some fully accept and follow their doctor's advice, while others might seek out second opinions, even going so far as to talk to doctors in their home countries about adjusting their medications. That suggests maybe they don't completely trust or understand their current healthcare providers.
Right. That's a very important point. And when it comes to pharmacists, it seems like people have mixed feelings. Some participants in the studies didn't really see pharmacists as having the specific knowledge to give advice on managing medications during Ramadan. They saw them more as just dispensers of medication rather than sources of advice on how to navigate fasting with chronic conditions.
Which is a real shame, isn't it? Pharmacists know a lot and could really help educate patients about safe medication practices during Ramadan, especially around things like timing and potential interactions.
Totally.
Mm-hmm.
And this feeling that some healthcare providers, especially those who aren't Muslim, don't really get, it seems to be a big reason why some people turn to sources outside of healthcare for advice and support. We heard about people turning to Muslim relatives or community members who have similar health conditions, feeling that they would have a better, more understanding grasp of the challenges of fasting with a chronic illness.
Yeah.
This really highlights the need for healthcare that's sensitive to people's cultures.
Yeah.
When people feel like their doctors don't understand how important Ramadan is or the nuances of their faith, they're naturally going to look for support within their own community.
And then we also see people changing their medication routines on their own. Some people decide to change their medication schedules, like taking a morning dose in the evening instead without checking with their doctor first. We even learned about a participant who changed their hypertension, diabetes, and heart medications based on advice from a doctor back home. That kind of self-adjustment can be really risky, can it?
Oh, yeah, it can. Without the right medical guidance, people could accidentally make their medication less effective or increase their risk of side effects. It really shows how important it is for patients and their doctors to communicate better and build trust. So let's think about some of the main things that actually affect how these folks manage their health during Ramadan.
Our research breaks these things down into those that are specific to healthcare providers and those that relate directly to the patients. On the provider's side, the provider's religion seems to play a role for some people. They said they felt more comfortable talking to Muslim providers who understood the importance of Ramadan and who shared their belief in accountability to God. Some even said they preferred getting medical advice about fasting from Muslim doctors.
Yeah, that feeling of shared understanding and cultural competence can be super important for building trust and having open, honest conversations between a patient and their doctor.
Right.
It's interesting, though, that our sources also said that some people found healthcare providers born outside of the U.S. to be more understanding, regardless of the provider's own religion. Maybe this comes from a shared experience of dealing with a different healthcare system, or maybe just a greater sensitivity to cultural differences.
That's a really interesting perspective that you might not think of right away. And gender came up as a factor too, especially for some women. Some female participants preferred having female healthcare providers, saying they felt more comfortable discussing their specific health concerns with them.
Makes sense. Cultural norms around modesty and privacy can definitely influence those preferences when it comes to healthcare. Now, focusing on patient-specific things, what did we learn about how people's own beliefs, experiences, and situations affect how they manage their health during Ramadan?
One big factor is whether or not patients actually tell their non-Muslim doctors that they plan to fast. Some people admitted to hiding this information because they were afraid their doctor wouldn't understand or might even tell them not to fast at all. Others, though, were encouraged to share their plans so their doctors could give them better, more personalized care and advice.
Yeah, that shows the tension that can sometimes exist between someone's personal religious practices and professional medical advice.
Right.
Open, honest communication is crucial, but it requires the patient to feel comfortable enough to share this important part of their life. And the healthcare provider needs to be receptive, knowledgeable, and understanding of the religious context.
Absolutely. Things like language barriers and whether or not good translation services are available also play a big role. One person explained that because her English wasn't very good, she just avoided asking her doctor any questions about fasting. Another person felt that even with a translator there, her concerns about fasting weren't really communicated or understood well. These are real and practical obstacles that unfortunately can get in the way of effective health management.
They really are. They highlight how important it is to provide culturally competent and linguistically appropriate healthcare to ensure that everyone has equal access and can communicate effectively.
Yeah.
Lastly, access to care itself was a factor. Some participants said it was hard to get appointments with their doctors in the U.S. quickly, and that this was a reason why they might end up changing their medications on their own. If they can't easily get professional advice when they need it, they might feel like they have no other choice. So for you listening, it shows a picture of individuals really trying hard to uphold their faith while managing sometimes complex health needs, sometimes facing communication challenges or feeling like they're not understood within the healthcare system.
No, our research also included some broader implications and recommendations from other studies in this area, didn't it?
Yes, it did. When we zoom out and look at the bigger picture, we see that this isn't just a local or isolated issue. Millions of Muslims with diabetes, for example, choose to fast every year around the world. And the medical perspective, as highlighted by big studies like the EPIDAR study, shows a much higher risk of certain complications like hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, for these individuals during Ramadan.
Those were some pretty shocking numbers. A 4.7 times greater risk of severe hypoglycemia for people with type 1 diabetes, and a whopping 7.5 times greater risk for those with type 2, along with a 5 times greater risk of severe hypoglycemia in individuals with type 2 diabetes. That really underscores the potential dangers if fasting isn't managed carefully.
Absolutely. That's why the medical community really stresses the need for individualized care plans, frequent checking of blood sugar levels, and making sure people are eating right during the non-fasting hours of Ramadan. Assessments before Ramadan starts and structured education programs are widely recognized as essential for making fasting safer for people with diabetes and other chronic conditions. There was even a study done in the UK that showed that participating in these education programs can really reduce how often hypoglycemia happens.
That's good to hear that being proactive with education can really make a difference in improving outcomes for patients. And our sources also talked about specific adjustments that might be needed for certain diabetes medications like metformin, sulfonylureas, and insulin. They emphasize that it's absolutely necessary to talk to a healthcare provider before changing anything about these crucial medications.
Exactly. And some groups are more vulnerable, like women who are pregnant or breastfeeding. They're generally advised not to fast because of the potential risks to their health and the health of their babies.
Uh,
Similarly, kids and teenagers who choose to fast need to be watched closely for things like dehydration.
right. And it wasn't just diabetes medications that were mentioned in this context, was it?
No, it wasn't.
We also saw something about patients themselves deciding to change their twice-daily anticoagulant medications and how that was linked to a higher risk of being hospitalized in a study done in Saudi Arabia. That really shows the potential downside of making big medication changes without professional medical advice.
Yes, it emphasizes the main theme we've been discussing. While the desire to fast during Ramadan is deeply important and religiously significant for many Muslims, it's really important to balance this desire with a clear understanding of the person's medical risks and the importance of seeking and following professional medical advice when managing chronic health conditions and their medications.
So as we wrap up this deep dive, what would you say are the main things our listeners should take away about this complex intersection of faith and health during Ramadan?
Well, the strong religious desire to fast among Muslims who are also living with chronic diseases leads to some really complex self-management behaviors and how they interact with healthcare. We've looked at how ideas about who qualifies for an exemption from fasting can be quite different, how medication use is carefully considered and sometimes modified without a doctor's guidance, and how the relationship between a patient and their healthcare provider is significantly shaped by cultural and religious factors.
And I think a really key insight for you, the listener, is that successfully balancing faith and health in this situation isn't about picking one over the other. It's about careful and thoughtful consideration, open and honest communication with healthcare providers, and often very personalized adjustments to medication schedules, not necessarily the dosages themselves, so that people can observe fasting while also maintaining their health and well-being.
Exactly. It's a delicate and deeply personal balance that needs sensitivity and understanding from everyone involved. And this leads to a very important question for you to think about. Given how deeply personal both an individual's faith and their health are, how can healthcare systems adapt and do better to support people who are navigating these complex intersections? How can we ensure that both their spiritual needs and their medical well-being are addressed thoughtfully and respectfully? Maybe think about the specific challenges that minority religious populations might have when it comes to accessing culturally sensitive healthcare.
That's a really powerful and thought-provoking point to end on. If you'd like to learn more about this, we definitely suggest checking out local resources or organizations that work to bridge the gap between faith-based practices and healthcare for deeper understanding of this incredibly important area. Thank you for joining us on this deep dive.